Taiwan reported to 2 more local COVID infections on Monday. One is a man who worked at the Novotel Airport Hotel. The other is the daughter of a confirmed case, an Indonesian China Airlines pilot who was diagnosed in Australia last month.
We turn now to the Central Epidemic Command Center.
The
first one, case 1145, is a Taiwanese man in his 40s who worked as a contractor in the hotel. From early April to April 28th, he was at the hotel on all days, excepting his days off. He developed a cough on April 28th and sought medical treatment on April 30th. After an assessment by health authorities, a test was arranged for him on May 1st, and he was diagnosed today. His CT value is 13. Case number 1146 is an Indonesian girl in her teens. She lived with a pilot who tested positive in Australia. Her other family members, case number 1090 and case number 1111, have no recent history of international travel. She was put in home quarantine on April 21st and tested for COVID. At the time, her test came back negative, but on April 30th, she began experiencing a slight fever, a runny nose, and throat discomfort, but the symptoms were so mild she did not report them. Since everyone in her family ended up testing positive, she was given another test on May 2nd and diagnosed positive today. Her CT is 19.
Tracing has begun for the infected Novotel contractor. So far, 23 people have been identified as close contacts. Authorities are also putting together a list of the patient's recent whereabouts. As for the other infected individual, the Indonesian teenager, authorities say no contact tracing is required, as she was already in home isolation when she developed symptoms.